tomorrow will mark 1 year since the World Health Organization first declared coronavirus a pandemic. We know this has all impacted families differently across the country, but this week I sat down with a Richmond couple who is reflecting on contracting the disease and the aftermath of going public.
I want people to take this seriously and stay home and don't go out unless you have to.
When I interviewed Joseph Papa back on March 18th, 2020, 77 patients in Virginia tested positive with the coronavirus. No deaths had been reported, and most people were not wearing face masks in public.
It's very strange to be known for this specific thing that I think if it had happened a week later or 2 weeks later, we would just be a statistic.
Joseph and his husband were one of the first in Central Virginia to go public with their positive diagnosis.
We were also very concerned at the time because we had such an active weekend and week leading up to us getting sick that we feared that we possibly infected thousands of people. Not knowing, because we didn't know how contagious it was.
Joseph talks about, at the time, experiencing the fear of the unknown about the disease for both his family and for strangers.
I had one person contact me from a job that I left in 2018 and asked me how long it had been since I'd been in the building, 2 years after I left the job.
A year later, we know more about the science of this virus, how it's transmitted, and how we can protect ourselves.
There were countless times where I'd wake up with a Lysol wipes on our front step, just anonymously left there.
Papa says his husband felt the brunt of the virus the most, but both have fully recovered with the occasional shortness of breath as they wait for their turn to get vaccinated.
I want to go to a theater. I want to go to a restaurant. I want to go to Joe's Inn. I want to go to, I really miss that. We really miss those things as well. And I also asked Papa what he's learned about himself over the last year or so. And he said this pandemic has forced him to confront his privilege. He says he's lucky enough to have access to health care, a job that he can work remotely in. He says there's still a large segment of our population, often communities of color, are still fighting for equity and equality during this pandemic.